Picture. I'm Tina Jha. US President Joe Biden's administration on Wednesday announced its support for a temporary global waiver on patent protections for the COVID-19 vaccines. A statement from the US Trade Representative read, and I quote, "This is a global health crisis, and the extraordinary circumstances of the COVID-19 pandemic call for extraordinary measures." So while intellectual property rights for businesses are important, Washington supports the waiver of those protections for COVID-19 vaccines, accepting a key element of a joint proposal that was made by India and South Africa and the World Trade Organization. The Biden administration said it will now actively participate in negotiating the terms. For months, the WTO has been facing calls led by India and South Africa to temporarily remove the intellectual property protections on the COVID-19 vaccines so as to help boost production in the developing countries of the world. Now, the announcement by the United States was, of course, immediately welcomed by the World Health Organization, with its Director General calling it a monumental moment in the fight against COVID-19. On this edition of The Big Picture, we will analyze with our experts the implications of the announcement of patent waiver by the US, how significant it is towards ensuring vaccine equity in the world impacted by the pandemic, and the challenges that remain in making it happen. Joining me are two distinguished panelists. I have with me Professor Y.K. Gupta, former head of Department of Pharmacology, All India Institute of Medical Sciences, Delhi, and Dr. Jayant Das Gupta, former ambassador, WTO. Thank you, gentlemen, for joining me on The Big Picture today. Professor Gupta, let me begin the program with you. Your first thoughts on the US now declaring support for a patent waiver on COVID-19 vaccines, and how, according to you, is it going to strengthen the global fight against COVID-19?
I think, as you rightly said, that this is a global crisis, an extraordinary condition of making vaccines available for the entire world, and therefore this requires extraordinary steps. WTO, or say intellectual property rights or intellectual property, is a very important thing. But humanity comes much before that. And that is what the India and South Africa's proposal is, that if you temporarily withdraw the IP protection and allow the industries, other industries, to also use the modern technology and the technology because of which the mRNA vaccines are being made, there will be companies in India will start manufacturing this vaccine, which will be efficacious, will make it affordable, and this will be a big step in taking care of COVID, which is I think, the worst pandemic of this century. This must be a very bold and very welcome step. There will be certain opposition for that, but I'm sure that the opposition, which is a business-oriented opposition, will be ultimately in favor of humanity, and that's why this is a very important decision which has been made, proposal which has been made by jointly India and South Africa, and I'm sure that all other countries which are today considering the negative aspect of this will ultimately fall in support of this proposal of temporary withdrawal of this.
Okay, Dr. Das Gupta, your views on the US decision, because it comes at a time when India particularly is battling a massive second wave, and experts are warning that a third wave of the pandemic looks inevitable. So how is this decision, in fact, the United States support to a patent waiver, going to impact India? How are we going to benefit from it?
The first thing which needs to be borne in mind is that the vaccines, from what we have learned from the experts, will probably have an effect for about 8 months to a year or a year and a half. So in order to contain the pandemic, we have to inoculate or vaccinate the vulnerable population, which is approximately, if you take 18 plus age group, and 70% of the population will have to be vaccinated. So from there, if you calculate what would be the requirement of vaccine, and you calculate also the available capacity of production based on the licenses which have been given by the patent holders, you will find there is a huge gap between vaccine production capacity, which has been licensed, and the requirement. So this gap needs to be filled. Now, how do we fill this? One of the first things which we do is to ramp up production, to increase the capacity to produce. Now, if we rely only on the pharmaceutical companies or the patent holders to provide the licenses to their franchisees, it may take ages and we may miss the bus completely. And so the issue is about allowing other players who have the capability, maybe the technical expertise, the production capacity, but which do not have the license to manufacture a patented product, to provide their manufacturing capacity to produce and to fill this gap. So this proposal of India, South Africa, and 57 other countries, which is supported by over 100 middle-income and low-income countries, it was basically not only about vaccines, it was about medicines, it was about personal protection kits, it was about medical devices, and all of which are required to tackle this pandemic. Now, the US has, of course, opened the door by saying that it will support this move in terms of the vaccine production. It has remained silent about the medicines, about the personal protection kits, about the medical devices, etc. But having said that, I must mention that as far as medical devices are concerned, for instance, ventilators, there is an overproduction in the global market, and it is easily available. There is no deficiency or shortage there, really. In terms of PPE kits, of course, there was a shortage in the beginning, but then that was overcome by many countries, including India. As far as medicines are concerned, we have still to find out a medicine which will prevent the replication of the virus. There are a few very promising medicines which are being tested out, molnupiravir, favipiravir being two of them. There could be others as well. Now, that is going to take time. And so the vaccines are of the essence to prevent the pandemic.
And currently, the United States move looks like a significant one if we talk about Dr. Dasgupta in terms of vaccine equity. But does it come as a pleasant surprise, the sharp reversal of the previous US stance? Because for months, India and South Africa, with, of course, support from other developing economies that you spoke about, they had been backing for this waiver proposal at the WTO, but the developed economies, which included the United States, had been resisting it. Now, what do you think could have been the factors behind the Biden administration overturning its previous stance on patent waiver?
There are two things which, again, need to be borne in mind. The first thing is there was a very important declaration on TRIPS and public health in 2001. And that had also been opposed very strongly by the pharma lobby. But ultimately, the President of the United States weighed in on the side of the developing countries, and that could go through. President Biden, in his campaign pledge, had not very explicitly, but he had made this promise that vaccines would be made available to the rest of the world. And that is, he's just been following up. And I would say that the gesture of the United States President is a very, very positive step. It is indeed, as the WHO chief has mentioned, it's a monumental step in our global fight against the COVID pandemic. And I think it is in keeping with the social responsibility and the leadership role that the US has always shown. And it has again assumed that leadership role. But for a minor blip, I think, in the past maybe 2, 3 years. But it is back to the normal leadership role which has been played by the US. And I think the global community, the pharma lobby will have its own reservations, and there would be problems. So we have to overcome that during the negotiations. But I want to make one last point, and that is that in the wake of the HIV/AIDS pandemic and tuberculosis and malaria and other epidemics, there was this medicines patent pool which was set up under the aegis of the WHO. And that is, again, part of the COVID technology access pool which the WHO has set up, to which, of course, there are no subscribers at present of providing technology and knowledge and data yet. It was set up in May 2020. So the medicines patent pool has been very successful in certain cases. For HIV medicines, for instance. A royalty amount of 3 to 5% on generic sales is provided to the companies which own the patent. So there is, and in the TRIPS agreement, there is this provision of adequate remuneration to be provided to the patent holder. So I think a balance has to be struck, and the US decision will enable the global community to arrive at a balance between human rights, between protection of the global citizenry and private innovation and research and development expenses.
Okay. Professor Gupta, coming back to you, because we are in a situation today where new variants of this virus are emerging. The outbreaks we are seeing are getting bigger and bigger by the day. Even in India, we've been impacted severely by the second wave this time. In such a scenario, even in such a scenario, I should put it like that, why are the pharmaceutical giants even opposing it? For the past several months, they have made profits. Now, when you say humanity stands above anything else, and there are talks of remuneration as well, what is the reason for them to oppose it vehemently? Because what we have seen in the last few hours, there's been severe backlash of the United States support to this proposal.
I would say that innovation or the drug discovery is a very expensive, time-consuming, risky process. Industry spends a huge money into that, and they have right in saying so that they have to recover their cost so that they can put back into the innovation and the research. However, when situation like this comes where the entire world gets involved, and then particularly the countries which are middle income, lower income, developing, which will also indirectly have an impact on any part of the world, then there has to be a mechanism by which this temporary suspension of intellectual property right should be there. So that it is particularly important country like India, where we have a very strong technology-based platform. We are called as a generic hub of the medicine of the world. We can make, provided this is a free technology use platform. And therefore, the technology for which mRNA is, for technology for mRNA vaccine, we will be able to produce the efficacious vaccine, and number of industries or manufacturing units will come in. The production will be increased and the vaccine cost will be less. I'm saying that it will not be lesser than that which will be not viable for industry. It can be viable, it should be viable, but it should be at a level where it is affordable to the country and the poor man and the middle income people also. And therefore, there are other ways also, like compulsory licensing, things like that. But this is the best thing. And I'm sure when the industry will sit across the table and will get a mechanism by which their sustainability, their viability is also preserved, but at the same time profitability will be rationalized, and then there will be not exorbitant profit. They can do this profiting at a later date for the different other purposes. But today when the humanity, when the entire world is suffering, not only that India is suffering, not only that the developing world is suffering, it will ultimately percolate, the benefit will also percolate directly or indirectly to the developed world as well. And therefore, each and every country, whether it is the developing, whether it is a developed, whether it is a Asian countries, whether it is a European countries, have to support, should support this. This is a very wise, I think, a very balanced decision or proposal, I would say.
Okay. Professor, do you also think another contention which the critics are making is that apart from hampering innovation, it could also compromise on the control of safety and quality standards of vaccine manufacturing? Is that a possible impact?
I would say two things. Safety and efficacy cannot be and must not be compromised at any stage. And therefore, there is an enhanced role, responsibility of the regulator of each country. And India, the regulator of India is one of the very strong regulator. It will never allow anything which will have any possibility of compromise in the safety. And therefore, those who say that this will compromise with the safety and efficacy and the data, they are, I think, perhaps not correct. We believe, we have a faith, and we have a confidence in our scientists, in our manufacturing units, and in our regulator who will do a good job in making only vaccines in market which is established safety.
Okay. Dr. Das Gupta, let's now talk about the challenges, potential challenges in implementation of this waiver plan. Now, the United States, even though it has agreed to actively participate in the negotiations, it has cautioned that deliberations are going to take time. So, in order to hammer out a specific plan, a waiver plan, number one, could it be time taking? And at the WTO level, help us understand what are the kind of negotiations that are likely to take place. Should the issue be unanimously agreed by all member countries? How does it function at the WTO?
At the WTO, all decisions are taken by consensus. So basically, all countries have to agree. What happens in actual practice is that once the major countries say yes, who have a stake, even if there are some less important countries in terms of a particular decision who do not really have much of a stake, but are acting only as, let's say, on systemic grounds, they are raising objections. Their objections are tackled one by one, and there is peer pressure and moral suasion which is brought to bear on them, and they are all made to come around and be part of the consensus. Now, there is in the WTO system no cutoff date for the end of negotiations. So that is one worry, that we have to have a specific timeline. And the next ministerial conference of the WTO is going to be held sometime at the end of this year in Geneva. So before that, much before that, in fact, we must wrap up these negotiations and have an agreement in place.
Absolutely. The urgency of the issue has to be addressed.
The second point I wanted to mention is that, Professor Gupta made a very valid point about medicines. We have been the pharmacy of the world. In the case of medicines which were off patent or which were generic in nature, we used reverse engineering to say it bluntly. And the average time which was taken to produce a medicine which was off patent by reverse engineering was about 3 years. In the case of vaccines, it is uncharted territory. So unless we get the technology, I'm not sure we will be able to produce it even in 3 years. Yes. So we need to have that technology. So there needs to be a meeting of not only mind, but of heart, of the companies, of the governments, the important governments where of the countries where these major companies are located. And that is when this thing will flow smoothly. and vaccines will get produced.
Dr. Dasgupta, you spoke about peer pressure. So could the United States decision sway the other developed countries which are still resisting the waiver? Is it possible?
Yes, because you need to also think about the huge pressure that global advocacy groups, NGOs, civil rights organizations, and legislators, in the case of the US, Speaker Nancy Pelosi has been at the forefront saying that this should be waived. And there have been about 100 congressmen and senators, mainly of the Democratic Party, who have supported this. So in other countries also, in Europe, there is a huge movement which wants waivers to be given. And so would be the case with the UK. So these are the major countries or country groups where these large companies are located, which are the holders of patents. So I'm sure once the US has said that it is in favor, there would be immense pressure which will be brought to bear on their legislators, on their by the civil society groups and other global advocacy groups. So it will be very difficult for them to sustain. And this is exactly what had happened in 2001 in the case of TRIPS and the Public Health Declaration.
Okay. Let's all be hopeful that the other countries also support the US in supporting this proposal floated by India and South Africa. Professor, coming back to you for one final question. We've spoken about how the global pharmacy groups are, of course, resisting this decision. There are challenges that are going to be there in terms of negotiations at the WTO. Are there any other problems that we could face in terms of implementing this waiver plan, which is going to benefit at large the lower income, the middle income economies at present?
I would say 2-3 things, as one Dr. Gupta has mentioned very correctly. Is relaxation or waiver of IP is one. But then once their heart melts and they agree on this, they should also come for technology transfer or making hands shake. And that will increase the speed by which we can, or developing world can develop the vaccine manufacturing process, the number of the units which has to be available in the record time, and also the apprehension, which is unfounded, I will say, of the quality. The next challenge is making the vaccines world quality, I would say acceptable quality. And our acceptable benchmark is no less than any world-class medicine. That is strengthening, that is important. We have a manufacturing units, fantastic, and that's why you see we are the pharmacy of the world. We supply to the majority part of the countries. So that is the second thing. Third thing is the resistance which will come definitely, I think, will melt down because of the peer pressure from our entire civil societies, NGOs, and I would say each and every citizen of the world will support it, because anybody who is interested in taking vaccine will support this. And after all, the industry, the giants are also interested in getting vaccine for themselves, for their friends in India, for their relatives in other part of the world. So therefore, ultimately, they will also agree. Negotiation, viability industry is perfectly agreeable, but affordability of the quality vaccine is also a responsibility.
Okay, so very, very important suggestions coming out of the discussion. Both our panelists saying that open sharing of technology, intellectual property will increase global vaccine coverage. That's number one. It will ramp up global vaccine access program, which the WHO is currently undertaking, which is called the COVAX. And the third and the most important thing, that unless we vaccinate the world, experts warn we will leave the playing field open to more and more mutations, and the outbreaks will be worse than ever. So this is the most important thing that we'll have to keep in mind. And to contain that, it's important that vaccine equity is maintained at the earliest to prevent and to strengthen this global fight against COVID-19. With that, I have to wrap this edition of The Big Picture. Thank you once again to both my guests for joining me on the program today and sharing your perspective with us and our viewers. Pleasure having you on the show. Take care of yourselves and your families. To my viewers as well, I want to make an appeal. We are going through some really testing times. Stay at home if you can to prevent the infections. But if at all you have to step outside, make sure you are masked up. The health experts say wear double masks if possible, maintain physical distancing, and keep washing your hands regularly. These are basic precautions which will help us and also our families from being infected. So take care of yourselves and your families, and thank you very much for your time.